afternoon, everybody. We have had a lot of fun preparing this next session, which is, as the title reads, the Field Team Conundrum for Product Launches. And we've had a lot of fun discussing and debating which is the right way to go. And we're going to spend a little bit of time taking you through the journey and teasing out some of the little idiosyncrasies. But before we do that, I am going to just take you through a little bit of a conundrum which may or may not be a real life scenario. So, picture yourself in November 2024. You are sitting there and you have several PBAC submissions in a rare disease area. Your company hasn't been able to get this product over the line, and you are working on a base case of launch, which is sometime in Q2 of 2026. So right now you're sitting pretty comfortably thinking there's a little bit of time here. And then at the end of November, you get given the green light and you are on in probably 4 months' time. Christmas is upon you, and you have a really big decision to make because you don't have a commercial team. There is no field force. So you have a choice to make, and the choice is one of two. So I'm going to get you all to stand, just very quickly, everyone up on your feet. And the other piece of information I'm going to give you is that this therapeutic area is one where the customers, the HCPs in this case, have a lot of bandwidth in terms of the product that are sold to them, which means that there are a lot of customer-facing reps that are out in the market. So I would like you to stay standing if you would outsource and go external. And if you think that you would actually hunker down and try and hire a team in the next 2 to 3 months over the Christmas period with a view to launch in April of 2025, I'd like you to sit down. Sit down if you're going to go internal, and stay standing if you're going to outsource. Ooh. You can do this, guys. Okay, so there's probably 70 internal, 30 external. Okay, we're going to let you all sit and we're going to revisit this at the end and see if we can change your mind. Okay, so which is the best way forward? You can all sit now. So my esteemed panel, I have here Beck and Kim and Daylan. Beck and Kim, you are both from MSD, which I wouldn't have guessed that when we first met because you have very, very opposing views. And I'm going to start with you, Beck. Take us through your views in terms of which is the best way forward based on your most recent experience.
Yeah, and firstly, Kim and I have very different views on this topic, and I feel that there's a bit of strategy in the seating up here on the stage. Firstly, disclaimer, Kim and I actually do like each other. We are friends, and we have known each other for a very long time. By the end of our time on stage, you may not actually believe that, but we are. I have had experience with large primary care sales teams in-house as well as specialty care teams, but my most recent experience has been with a hugely successful partnership with an external contract sales team. And it was in a therapeutic area that we weren't really expecting the launch. It came rapid and it came fast, and we needed to be able to switch on a sales team very quickly in the primary care landscape. So we obviously know there's a huge customer base in primary care, and we needed scalability. And so that's exactly what we did. We went external, and through the partnership, it was extremely successful. And I have to say that now for future product launches, Kim and I have had many discussions, and my opinion would be that I would look external. And I know Kim's got a different opinion because Kim ideally would like to protect her job. And so we've had a lot of discussion on this topic. And Kim, I know your opinion's quite opposing to mine.
And Kim, you're in oncology as well. We should set that up. So highly specialised. And we know that oncology is very unique and special. Every time I've worked in oncology, that's how we like to be seen. But we're all very special. Oncology does have a reputation for really needing deep subject matter experts. So I am keen to hear and understand from you your view.
So firstly, Beck and I are friends, but not today. But my experience has been with MSD, and I've worked in oncology probably the last 10 years, so my experience definitely has been internal, and also starting a team from scratch. One of the key, I suppose, benefits of having an internal team is that you've got that, your team that have a deep knowledge of their customer base. It is quite unique, as you say, Danny. Oncology is quite special. But in the absence of a contract team, and to my knowledge, I don't think anybody in oncology has had a contract team. So I think those are the limitations that you do work with. However, the other thing for me is that ability to pivot. And I think when it comes down to productivity, when you do have an internal team, you have that ability to promote and at the same time prepare for an additional therapeutic area launch. And, those are the practicalities in field. So if you're about to do pre-launch activities, things like appointment making, profiling, those are all the things that need to be done on the ground. And we all know that by the time you get to October, if you haven't set those appointments in, you can almost lose a whole year in field. So that's what I found is some of the benefits of having a sales team. The other thing is that an internal team also forms part of a bigger culture. So, you've got the company reputation, you've got career development, which, to a lot of people who are looking for a career, that can actually play a big role.
They are very convincing points.
And I know Beck's going to say that.
I was going to say, I can't help myself. I know. I'm going to just jump in, if that's okay. Is that all right, Daylan? Okay.
Sorry, Daylan.
On the opposing,
Daylan,
I actually think that some of those points are a distraction. And I think that having an in-house team, that on-the-ground profiling or getting engaged in strategy or getting engaged in career development or culture can actually be a distraction for the team. And I think with a contract sales team, they've got really clear KPIs. Their focus is to sell and to achieve those KPIs. And so therefore they're really focused, I think, on the goal and the target without the surround sound distraction.
That's my turn.
Daylan,
Before you keep going back and forth, I love tennis, but
you've worked in large organisations. You're currently at Takeda. It's a little bit more niche, and you're looking at rare disease. So I'm dying to hear: are you Team Beck or are you Team Kim?
Team Takeda, but
Good answer.
Instinctively, I would lean more towards Kim. I'm internal, as the majority of people here did sit down quite quickly. And that is, instinctively, I had to think, okay, so where's that bias coming from? If I'm going to open up my mind, be more considerate, thinking what's next. I think that comes from previously having concerns about trusting the expertise of the contract team. I think that's something that I've had some other experiences and I've had concerns about. Also, the reputation of our company, is that contract team going to represent our company well? There are a couple of thoughts, but I think really the better question is actually about who has the best relationships with the customer. Now, that last session said, who's the true customer of Pharma? I'd say the true customer of salespeople is the HCP. Not for Pharma. Pharma is the patient. I'd say I'd agree with that. So I think that there are many situations, and yours hypothetical one is quite interesting, because there may be times where how much time do you have to build up a team? What relationships do you have in place versus a contract team that may have relationships in that place? And so what would the experience be for the customer? For the HCP, sorry, for medical people, for the clinician, what would the experience be for them? What would they prefer? And I think that's all got to come into account. So whilst I instinctively would say internal, I think in this changing environment and the pace of change, that we need to be more open-minded.
And I think that's a very fair point when we consider that our field force is our most expensive spend or cost that we have as an organisation. Being able to keep them selling and doing what it says on their business card is absolutely important, and selling is not a dirty word. So I guess I'm a little bit curious. You've introduced this notion of the relationships, being able to pivot, being able to really react and scale up. There's a company culture piece. Under which conditions does it make sense to then go external, and when can it really thrive? And Kim, I might start with you in terms of when could you potentially see the benefit?
Yeah, and look, I mean, my background is obviously in oncology. There are no contract teams, so I think where I would go externally is when you're in a very small niche therapeutic area, and you have got a contract team that has got that therapeutic knowledge and the customer relationships and have built trust over time. I think that could be a winning formula. So, but without that, I'd be reluctant to go with a contract team if you have an internal sales team that can do that and even better.
Daylan, what's your take?
I just thought that Beck would have to come in.
Go
Beck,
ahead.
you go first.
I was going to make one point. Just on the trust and the relationships, I completely agree. I think that we need to build relationships and we need to build trust. But once again, I think that there is this balance that we're trying to achieve, because we can build such strong relationships with our healthcare professionals that we actually go in to see them and we forget to sell to them. And I think as salespeople, we still need to sell. Even if you've known that healthcare professional for 5 years and you've been talking to them, developing a relationship, yes, important, but you are still there to do a job, and you are a sales team that needs to continue. Remember, I suppose, the core, your core assets and skill set, which is engaging, forming that relationship, but selling your product to ensure that they are giving the right product, the right medicine to the right patient to enhance those patient outcomes. And so I think that's really important. Oh, go on.
We've had some great conversations before today, and I think the part that's really stood out in my mind that you shared, Beck, is around that valued business partnership with that contract team. That's something that I'm sure you can talk to more in a moment. But I think the part that stood out for me is you really have to set expectations with that contract organisation. If you've got the line in the sand very clearly at the beginning around the expectations, your level of involvement with their sales team, and what that looks like around your objectives, their objectives, I think if you've got agreement around which parts of, say, your selling model or various ways of selling you want to help train their team on, if you've got that connection and that partnership, then yeah, that builds my interest in moving that way in the future.
Yeah, and that's something that we did talk about a lot. I'm very pro external contract sales team, but it comes with a big but. It needs to be a partnership. And so if we think that it's a set and forget resource that we've invested a huge amount of money and they will take care of themselves, that's definitely not going to be a successful partnership. And I think what was successful with the partnership I most recently had was it was a true partnership. We put a lot of internal resource behind working with the sales team. I treated the sales managers like they were my own internal sales managers. I spent time in field with the sales team. We didn't just train on product. We trained on how we wanted them to sell. How we wanted them to engage with the healthcare professional. So we went above and beyond, I think, what potentially was expected, but in return, they went above and beyond. We were passionate about the product, they became passionate about the product. So when they're excited and driven and as passionate as we are, because we invested so much of our time and resource with them, that's what made it a really, I think, successful partnership. It's not a commodity that we can just pay for and expect it to
tap in and tap out of. You've got to put in the hard work regardless.
That's exactly right.
Continue that.
Yeah.
So Kim, with this notion of the talent and the training and the continuity, I know it's something you feel very strongly about. Talk to us about that specialty care, particularly in oncology, and why that's so concerning for you.
Yeah. Well, I think once you've invested in a team, I think it's important, there's a couple of things, is ongoing learning and development, ongoing training to keep that skill set level up, and then there's the career development. But specifically when you've got a field force and you've got multiple tumours, for example, or therapy areas that you want the team to do, I think it's critical to prioritise. Because, adult principles of learning, you can't just layer everything at once. So if you're expecting a field force to, promote 3 or 4, and I think that sweet spot tends to be 3 or 4 to get that depth of clinical knowledge as well, then it needs to be considered as in prioritising, when new information comes about, you might pull back on one, promote the other, do training.
Consider
like
competitors. Is it a competitive market?
Absolutely, yeah.
So there's a lot of elements here, and I'm curious, is there a role for a hybrid model? And Daylan, I'm going to hand over to you.
Haven't done it before in the same space. I know we've previous companies I've worked with, we have gone down that role when you want to get awareness out in the primary space while you have a specialty team internally that is driving the promotional direction of the company. So I think there is a space. I was thinking with that question, I could even see it where you have a team that's very much focused on, like for example, I work in the area of IBD, and many of the specialists call themselves IBDologists. Even though that's not a technical on your certificate term, they're gastroenterologists, but they refer to themselves as IBDologists. And I think I could see there'd be a time where you'd have a different field team for some of those KOLs in that space, different team for your general gastroenterologists. Yeah, you've got to be open-minded.
It's an opportunity, right? We've got a couple of minutes left, so I'm going to, before I tell you what happened in that hypothetical situation, I'm going to throw to Kim and just ask you to maybe give me 2 points and under which conditions the external for you is just a no-go.
When it's a no-go. I would definitely not use an external contract field force if they do not have experience in that area. So I would consider it if they did, but not if they don't have experience or they're not playing in the area, then it's a little bit limited for me.
Yeah. Okay. Beck, internal.
When's
it's a deal breaker for you?
Oh, when's an internal a deal breaker? Good question. I just think we've touched a lot in quite a few sessions today about the unpredictability of the market. And so if we're trying to launch products when the timelines are really quite sketchy, and
you're at the mercy of the PBAC?
We're at the mercy of the PBAC. I think that I wouldn't go internal. I think it's just a really expensive investment that if we don't get that positive PBAC recommendation or PBS listing, then you're sitting with quite an expensive headcount and possibly no products to promote.
Yeah, and I was going to add to that, I think you're absolutely right, Beck. If you've got an internal sales team, you've got that ability to pivot. You can, while you are waiting for a launch, do other things and be productive.
My final comment would just be,
comment.
What is your organisation's commitment to that space? I think that's really important to know from a high-level view, because if this is a product you're going to have for a short time, there's a space for contract team. If you're thinking you're committed to that therapeutic space for the next decade to come, then internal is where I'd go.
That's the way to go. Thank you. So we've got a couple of summary slides that I think pulls together for us when we felt a contract team did make sense. And you can see them there where there are those existing relationships or the speed to market and agility is important, and where you can culturally integrate, and when an internal team makes sense, or come and talk to Kim because she'll talk you into it. And we are right on time. I will tell you, in that hypothetical situation, I did go internal. Christmas was cancelled that year, and I did hire a team, got everybody up and running, and we managed to launch on April 1st, which was nothing short of a miracle. We were building the plane and flying it at the same time. Happy to say that we are sitting in the top 5 globally in terms of launch countries at 5 months in, so that's no small feat. However, we do have some interest in this space, and that was a case of, do I bite the bullet now or do I kick the can down the road? So it depends, and there is no wrong or right, which is exactly why it makes it a conundrum. Thank you very much.